Hello everyone, my name is Dr. Sagar Bhargava. I'm a cataract, glaucoma and refractive surgeon. In this video, I'll be discussing with you the top 10 queries that patients ask whenever we speak to them that you have cataract. So it's more of an informative video and it will give you some information before you go to your doctor and he diagnoses you with cataract. So what is the first query when you tell the patient that you've got cataract? He will ask you, so doctor, is my cataract mature? Now, mature cataract is a concept which was very much there when there were no advances in cataract surgery. For example, when there was no microscopes or when there was no phacoemulsification system which we routinely use now. So when a patient develops a mature cataract, he'll absolutely see nothing. You will only able to feel light perception. And that's a very advanced stage of cataract. So mature cataract, those seen nowadays rarely, but it is still seen. So the next question that the patient will ask is, should I wait for the cataract surgery till my cataract matures? Now 20 years back my answer would have been yes, you can definitely wait till your cataract matures, but in today's era that is not the right approach. The approach should be whether my cataract is causing me trouble enough to affect my day-to-day activities. Now that activity will vary from person to person. Like some people are involved in driving, so they will have more difficulties. Some people are involved in computer work, they will have their different level of difficulty. Some people are just leading a very sedentary kind of a life with minimal activities. For them the level of difficulty may not be much. So the assessment of difficulty with regard to the current stage of cataract is a self decision. If you feel that the cataract is causing difficulty, yes, it's ready for surgery. But if you feel that you are able to manage more than 80% of your activities without much of a problem, you can surely wait. Waiting for maturity to happen is not a wise thing nowadays, because we know that mature cataract comes with its own set of problems. Number one being, the cataract when it matures, there is a very small chance that it may rupture, and that can give rise to an acute glaucomatous attack, a sudden rise in eye pressure, redness, pain. The pain can be very severe that you might have to admit the patient to relieve it. And we have to operate these patients in emergency, and when we operate in emergencies, it's always difficult to get a very good outcome out of that. Second problem with total cataract is, technically it becomes more challenging, because the cataract, once it matures, that means it has become very hard. So with the latest technologies that we use, harder cataracts pose a little bit of risk intraoperatively. There is a high risk of complications that can happen. So in today's times, it's not a good idea to wait for the cataract to mature. Only thing you have to see whether the cataract is causing you difficulty. So the third question is also linked to this. What happens if I don't get my cataract surgery at all? There are some patients who also ask this, especially the ones who are in late 70s, early 80s, because they feel that they are able to manage with the other eye. Why should this cataract be done? Well, there are certain tasks which need both eyes to be working. For example, your depth perception needs both eyes to work simultaneously. Number one point. Number two point is that you have a functional eye. Why would you not use it? Just because you don't want to get a surgery done, that's not a right approach at all in today's time. In fact, I would say that age is not the criteria at all. I myself have operated even a gentleman of 102 years of age, and the zeal in that person was as good as a young person. So if there is cataract, it should be out irrespective of what age the patient is, and there's no point in leaving the cataract in place, because just a while ago I did speak about the problems that can happen if you don't operate a cataract, and it can rupture and can cause many complications. Another query that the patients ask is, doctor, will you be doing the cataract surgery by laser. Now, laser cataract surgery has been propagated a lot, but let me be very clear on this, that laser has been made for cataract surgery can address only three steps for the cataract surgery. What are these three steps? First is creation of the incision, second is creation of a opening in the cataract, and third is softening the cataract. Once you do these three steps, you are taken back to the normal OT, and then the surgery is done by phacoemulsification. Phacoemulsification is a technology which has stood the test of time. It's been more than 2 decades now since it's been in practice and use. It basically uses ultrasound energy to remove the cataract in situ, and the advantage being that the cataract can be removed through that small 2.2 millimeter incision. So laser cataract surgery is a myth. You are only doing few steps with the help of laser. The remaining steps are done by the standard phacoemulsification only. Right. So the next question that is commonly asked is, what is the best lens in the market? Now this is a very common layman query that comes to a doctor. That doctor, I want the best. Whatever you do, you give me the best lens. Now this is again a thing which is a wrong approach. Every person's eye is different, and what is good for that particular person may not be suitable for another person, and vice versa. So the best approach to this would be to assess your own needs, have a thorough eye assessment, then discuss with your doctor as to what lenses are possible for me in my eyes, and based on your need, a lens selection should be undertaken. So I would put it in this way, that the best lens is the lens that suits you, not the most costliest lens. Okay, so the next question which is commonly asked is, will I need glasses after the cataract surgery? Now, need for glasses basically depends on a choice of intraocular lens that you would do before the cataract surgery. Now, before a cataract surgery, if you choose a multifocal or a trifocal IOL, then the need for wearing glasses after the cataract surgery gets reduced to a significant extent. Having said that, not every eye is fit enough for implanting those kind of lenses. So it's best to discuss with your doctor to see whether your eyes are fit for that particular lens, and will you accept the minor side effects that come along with the advantage of getting rid of glasses. So glasses, the majority of patients basically opt for monofocal lenses, which means that those lenses will correct distance vision, and for reading and near activity, patients will have to use reading glasses. If you would like to know in details as to what are different types of lenses available, what are the different, how do I make that decision, I will just give you a link in the description box, which is a video which nicely explains all that. Now, the next question is, will all my symptoms like eye pain, redness, irritation, and seeing black spots go away after the cataract surgery? Now, this is a very common human tendency. Is when they have an issue, they try to link it with certain other issues which may not be coming out of that particular point. So, for example, the patient may have dryness, dry eye, which the patient thinks is because of the cataract. Or patient may be seeing floaters or black spots, which is basically an issue of a natural age-related change in the vitreous shedding. So these things have absolutely no link to cataract surgery. So even the cataract surgery will only give you clarity of vision, but these symptoms need different kind of management or treatment. So this one has to keep in mind. So the next question is the cataract surgery painful? Will I need injection? Well, in today's time, the cataract surgery is absolutely painless surgery, and the best part is that even the anesthesia does not need any injection. Patient's eyes are basically numbed with the help of eye drops. So it takes about 10 minutes to 15 minutes maximum, and the surgery is completed while patient is absolutely comfortable and even talking. So remove this myth from your eyes. Now I've seen many patients who really postpone their surgeries just because they have this fear of pain and a phobia of operation. Right. So let's see the next question. So what is the incidence of problems and complications after cataract surgery, and what are these issues? This is a very valid question. I think all the patients definitely need to know this before undergoing cataract surgery. Cataract surgery is a very safe surgery, and in 99% of cases, really, there is no issue. In 1% of patients, you can have some minor problems or issues like irritation, dryness, foreign body sensation, and discomfort continuing for 3 to 6 months post cataract surgery. And these patients probably would need some additional medications to uh, to to counteract these problems. Their surgeries are absolutely fine. They are seeing very well, but these symptoms can cause a little bit of mental stress to these patients. Major complications that can happen are mainly infection, increase intraocular pressure, and very rarely retinal detachment after cataract surgery. Now, the incidence of these complications are very, very less. And the good point is that even if they happen, a timely intervention will make sure that patient does not lose any vision. Let's look at the next question. Can the cataract come back? Now, this is again a very common myth amongst patients. When they see their relatives having a very good vision after surgery, and after 2 3 years down the line, their vision becomes hazy. Now, why does this happen? So, first thing to understand is that the cataract, once removed, never comes back. The reason why it never comes back is because in its place there is a lens which is sitting there. We have to remember that this lens sits on a transparent membrane. Now, what can happen over a period of time in about 20 to 30% of patients is that this membrane can get opacified. This opacification is called as this opacity is called as posterior capsular opacification. And if it becomes significant enough to cause visual disturbance to the patient, then a laser treatment can be given to these patients in the OPD itself. And it's a very small, minor procedure lasting for just 5 minutes and totally painless. And the moment you do this, by next day, the patient's vision is back to normal. So these were, in short, the 10 most common queries that I have seen in my practice, and I hope this information is useful to patients who plan for their cataract surgery in future. Thank you.